So, welcome to the RMD podcast with me, your host, Dr. Debra Durst, and my co host.
Hey guys, Farideh Golembiewski, family nurse practitioner here at RevitalyzeMD. And today we have a great podcast.
So, it's something we talk about on a daily basis. It's medical grade supplements. We love medical grade supplements. It's the only thing we sell at the office. And today we're going to talk about Designs for Health as one of our favorite supplement lines. So, getting into it again, supplements are necessary, just to optimize cellular health, vitamins, minerals, supportive any, physiologic function. But basically, they're not regulated.
And they're not all created equal.
No.
So I think that's really important when patients ask us, well, I'm taking all these things, but do I really need to be? And quality has a lot to play into that, different brands, different types. And as Dr. Durst said, it's not FDA regulated.
No, supplements are not regulated at all. So our office, we ended up next to a supplement store. And again, I trusted that this supplement store was actually doing some research. So I used to go there before we opened the office. But we have not at all competed with them. They do a great job of researching supplements, but we do all medical grade because they are third party tested. So those companies that are medical grade have to actually prove that they have the ingredients in that they claim they have in. And that's hugely important versus buying them at Costco, CVS, just any store. You think you're getting fish oil, but are you really getting fish oil?
And I think that's probably the biggest takeaway between regular over-the-counters and medical grade is over-the-counter. Even though they're medical grade, they're still supplements. So there is not this FDA approval. They're not regulating it. But with medical grade, as Dr. Durst pointed out, they are doing third-party testing. They do have clinical information supporting it, clinical formulations. So there is a more in-depth look at them. And Designs for Health is a fantastic company and one of a few that we use as a go-to.
Yes. And so again, top supplements, all of our patients, like we have top supplements that we'll put patients on, but all of our patients are on supplements and for various reasons. And there's a couple go-to that almost every patient, both male and female, are on. But basically, a lot of patients will come in already on supplements. And again, we just have a conversation about why sometimes they do individual ingredients, which is a huge thing because then you're on 20 supplements. Where do you really need those if you're optimizing health in other ways? But also, do you need all of those when you can maybe take a combination product? So we'll look at supplements when they're on them. And then we will look at blood work and then we guide our supplement choices based on that. And so some top ones that we use.
Well, even just to cut back to, like you said, we look at labs. So it's very common for me to have a patient, let's say, on a vitamin D supplement that they get from the grocery store or Walmart or wherever, whatever the place may be. And we'll look at their labs and they're like, well, why is that low? I take a vitamin D supplement. So quality is a big difference between some of these brands.
Yes.
So looking at the labs can help guide what we do need to change. Some of the things that we're taking might be fine over the counter from a store. It may be effective where others are not.
Correct. And so that does guide even the dosing of those supplements.
Absolutely.
So sometimes, we don't necessarily want them to throw that out, but if they're on, say, 5 and the levels aren't good, let's double that until we can actually switch you over to something else.
Exactly. Because nobody wants to throw away money.
Yeah.
Especially if they've already purchased all of it.
Yeah.
So we can help guide that dosing with labs.
Yes. And so there are some top supplements that we'll talk through that we use from Designs for Health or any other company. And so we'll just talk about reasons. So multivitamin is one of them. And so having a multivitamin that just gets you all the vitamins and minerals, but maybe not necessarily a calcium, which isn't necessary as a supplement for men or women, yet calcium is frequently something that they come in on, especially women, right?
Yep. And as an additional supplement.
Yes. Yeah, they will randomly be on a multivitamin or other things, and then they'll be on a calcium supplement. But calcium supplementation also isn't necessary. So if you have adequate vitamin D, which is one of our top supplements, then you will flux calcium out in and out of the bones. And so if you have adequate vitamin D, it's not necessary, but also it can be a nidus or a, kind of a source of calcium blockage in arteries, but also cancer formation. So taking calcium, kidney stones. So
too high of calcium can cause kidney stones.
And I think that's a frequent traditional medicine supplement.
I agree.
That they put people on, and we frequently are taking people off of that. And if you have a good multivitamin and you have great vitamin D, then you typically do not need a calcium supplementation. So, but vitamin D is one of our top ones, and almost every patient is on it. We can talk about that.
It is unbelievable how many people are deficient in vitamin D. And even those that are like, I take a vitamin D supplement every single day, they're not taking a high enough dose. If you don't convert from the sun or don't get enough sun exposure, or not getting enough in our food source, which we are not, because we don't want to be eating foods that are fortified with D. We want it naturally in our foods or naturally from the sun. Then we need to supplement that with a D supplement. And oftentimes it's at a way higher dose than what we think we need.
Yeah. Well, and that is a misperception in medicine and across the general public, is that vitamin D levels. So we optimize to an 80 to 100 vitamin D level, and frequently 30 or 40 is what the traditional doctors are doing. So you'll have family members or a doctor saying you're on too high a dose, but that is something that we follow on a regular basis. In our skin, we produce that active form of vitamin D, which is a prohormone in the skin, but our skin does not convert. And you basically have to be outside, peak sun.
Yeah, for like 2 hours. Naked.
For like 2 hours.
90% exposed or something ridiculous.
And who's doing that? Well, there's probably some that are doing that.
I mean, in the summer in a bikini, you might hit it. But even then, not everyone. That's if you're going to convert.
Yes. And the skin just doesn't convert like it used to. And then you also have to think that vitamin D also, our absorption of vitamins orally isn't always great. And so you might get about a 20% absorption of a vitamin. So it just depends on the formulation. So even if it does have that concentration of vitamin or supplement in it, then sometimes we don't absorb it adequately.
And that's another great thing about medical grade supplements, is they do have liposomal forms where they're in a liquid form for better absorption. So it's another reason why we like a medical grade.
Yeah, a lot of people also just get sick of taking pills.
Yeah, or just as an alternative.
Yeah, and some of them are horse size, as we frequently hear. I'm sure that you've heard that term from family members, right? So, but fish oil is another one that is a definite. So if you look at omega-3s, there's anti-inflammatory benefits across the board. So decreased inflammation. All diseases happen as we get older. Inflammation rises because of hormone decline, and inflammation is the source of all diseases. So brain, heart, cardiovascular, all of that is inflammation. So omegas will help with that. And all of our brain cells are fatty cells that communicate with each other. So having a healthy dose of omega-3s is important. Yeah. So that's a supplement I would highly recommend. And
vitamin C is another one. We talk a lot about vitamin C just for, during the winter months, during high viral times, but all the time we really should be on a vitamin C supplement. It is such a huge antioxidant. It's so good for us just in general. So a good quality vitamin C is huge.
And then we have done a previous podcast on just high dose vitamin C through an IV for decreasing inflammation. But in addition to an antioxidant, it is also significantly decreasing inflammation. And then while we're on vitamin C, because vitamin C and collagen cross-link, so for skin health, you would want to be on both of those, and those are top supplements that we use. As we get older, we'll notice skin changes as we look in the mirror, and so the things that can make a big difference are collagen and vitamin C.
And vitamin C can help with brightening skin as well. So,
which also brings us to, glutathione or NAC, if you haven't heard of that. So glutathione is the master antioxidant in the body, but it's not absorbed orally. So the liposomal form that you talk about is what we use frequently, and it's underneath the tongue, bypasses GI absorption of it. And so
you can also do injections or IV, but for over-the-counter supplementation, we don't use an oral capsule or pill. We use liposomal just
Yes.
because of absorption. The gut's a very acidic place. It doesn't play well with others nicely.
Yeah. Yeah. And it's often inflamed.
And it's usually inflamed because
Yeah.
we have poor gut health in our country
Yeah.
in general.
And
But
then again, Designs for Health is a huge source of education for gut health as well. And they have lots of supplements that help with GI health. There's lots of powders that help with GI. There's detox that they have, detox programs, 10 days, 14 days, even longer if you want. So good. A website for education, and we'll link that in the description. But NAC is something you can take orally, which is N-acetylcysteine, which converts to glutathione in the body. So that's how you would bypass needing to take glutathione orally. You can take NAC in a capsule form, which is great inflammation reducer as well.
yeah,
And
it's good for liver. It's good for kidneys. It's good for blood turnover. I mean, it's really a wonderful supplement.
Yeah. No, and I like NAC and milk thistle
Yes.
together for liver health. Those are the two big ones to use
Yeah, milk
together.
thistle's huge for liver health if we're
Yeah.
talking just trying to get enzymes, liver enzymes down.
Yes, yeah. Both of those are necessary if you have any elevation in your liver enzymes, because that does mean inflammation in the liver. And so even if there's not a bad cause for it, you still do not want a low level of inflammation even, because it'll lead to fatty liver disease eventually. So, and then DHEA and Libido stem.
Yeah, so our hormone specific,
Mm-hmm.
right? There's a lot of supplements that Designs for Health has that are hormone specific that help
Yeah.
with either promoting, supporting, or helping balancing hormones.
Yeah. And those are two big ones, DHEA. And then Libido Stem is a combination product that we were talking about that, again, you don't need to take things individually, but it has lots of good things in it. DHEA in it for women, but Libido Stem also has horny goat weed.
Which is a phenomenal supplement to help increase free testosterone. So if you guys are interested in learning more about horny goat weed, we do have a podcast on that as well. So check it out.
Mm-hmm. And then even Tonkat Alley is in there, DEM. So there's all kinds of different agents in there. And we actually have done a previous one on Libido Stem too.
Oh, that's right.
And so it talked about Libido Stem for men and for women. So, but those are some of our top ones. And again, gut health, liver health, brain health, cholesterol and lipid panels, because omega-3s are very helpful for that as well. Gut
Red yeast
repair.
rice, that's another one that we use for cholesterol when you bring up lipids. I mean, we do have probably about 10 different supplements we probably go to pretty frequently.
Yeah, like almost on a daily basis and multiple times a day. But so in the description, we will have a link that links to our top supplements from Designs for Health. And so you will be able to read about them. You will have, this podcast to kind of refer to for our top ones. But the takeaway with this is that not all supplements are created equal, and that medical grade does matter because of that third-party testing. And
That's
so,
it. And as Dr. Durst said, Designs for Health has great patient education. So when you visit the link and you go to the individual supplements, what's really nice with Designs for Health is they always have a patient education form that breaks down all the different parts of the supplement, what the blends are, what they help for, and the science that backs it. So it's really nice to see all of those. And it's soy-free, gluten-free, vegetarian.
Oh, yeah.
It's and a lot of them are vegan, so it's
It's
all the
it's human friendly, animal friendly,
non-GMO. I list all the things.
All the things,
They are all listed there. So I know we joke around, but it is definitely for some patients a big thing on if they can have anything gluten or not, and they are. Most of their products are gluten free.
Well, and it'll definitely lay that out for you too, so you'll know what you're getting into.
They're in the little circles at the bottom.
Yeah. And they also, when it comes to gut repair, they have medical foods on there. And so if you ever did a detox, it actually walks you through things you can do and foods you can take during a detox. So super helpful if you have any GI issues and want to decrease inflammation in your GI tract. So hopefully that helps. That is one of our favorite companies. It's not our only company, but it is one of our favorites. And so check the link out and check those supplements out. And then let us know if there's any specific supplements that you would like us to talk further about. Because again, we're willing to deep dive into anything wellness or sexual wellness.